I'm joined now by David Mills down the line from Moorgate Andrology, one of the UK's #1 penis enlargement clinics. That's what it says on the bit of paper in front of me. David, welcome to the Asian Network.
Hi, good evening, Mubin. How are you?
It's very nice to speak to you. I've also got Manny, who's called in from Birmingham. Manny.
Hi. Okay.
Yes, it's a woman. Brilliant. I'm going to come to you in a second. But David, first of all, tell me a bit about your day job. What do you do? Why do you spend all your time hanging out with dicks?
Well, fortunately, yes, we do. We do spend a lot of time hanging out with dicks because we see lots of guys coming to us who are unhappy about their penis size. So
Really? Okay, give me some numbers. What is it a trend? Is it an upward trend?
It's definitely an upward trend, but then so is cosmetic surgery for men. You know, I think it's this general rise in men wanting to look better, taking care of themselves, being prepared to have cosmetic surgery. But as far as penis enlargement is concerned, I think it's only in recent years that this has really become popular. As more and more men, they do their research online and they realise that they can have this thing done.
And tell me, are there any averages in terms of the demographic that come to see you? Is it a particular age bracket? Is it a particular racial background? Tell me, are there any kind of averages?
Well, I mean, we see men from 18 to mid-80s, believe it or not. I mean, we haven't operated, just to be clear, on anybody in their 80s, but it hasn't stopped one or two coming. But I mean, on average, you probably have to say men are between sort of 20 and 40, really. Demographics, yes, we do see a lot of Asian men because statistically, and this is a generalization, but Asian men, they tend to be a bit smaller than Caucasian men, and we're all smaller than Afro-Caribbean men.
David, if you could feel the energy in the room as these 3 Asian men, including myself, sit here and hear this and all look at the ground.
No, don't. It's a generalisation, really, trust me.
In the study that they did of 16,000 people, the urology department looked at it, they found that statistically there was no difference between the races. Now, it doesn't mean that there isn't one, it just means in the 16,000 people they took. But obviously experienced, you see a whole load of penises and a whole load of ethnic hues, and that's what you see, and I could completely understand that. I mean, certainly the width of Asian penis can be narrower sometimes, and certainly that's why they launched a sort of narrower series of condoms, and that's really important in terms of fit.
Dr. Anand, how many people did you say were in that study?
16,000.
16,000. So, David, I just want to ask you, is there any part of you that thinks it might not be that the penises are smaller, it might be that there's more anxiety? Because there has been this thing for, I'd say for decades, since I was a boy, about Asian men, East Asian and South Asian men having smaller penises. Do you think, in your experience, and just be honest with me, the penises that you've dealt with, do they tend to be smaller when they're attached to an Asian man? Or do you think those men just have more anxiety?
Truthfully, we see a lot of men who have small penis. They are Asian and their penis is small. I mean, they know it is. We know it is and they know it is. But, when you get into the concept of penis size, this is where things become very grey.
Let's get down to numbers. What is small?
Yeah. Well, that's the $64,000 question. What is small? We see lots of men who statistically have a normal penis, what might be considered a normal penis size, but they're not happy with the size. And I use the analogy. If you look at the analogy, for example, of breast enlargement in women, thousands upon thousands of women have breast enlargements who have got a perfectly good C-cup bra, but they're not happy with the C-cup bra. They want a D or a double D. And we see an element of that. So in penis enlargement,
David, is there a tiny part of you, and maybe it's just the industry that you're in, is there a tiny part of you that thinks you're really profiting and exploiting that insecurity?
Well, I have to say on the whole, no, because, I spent 36 years in aesthetic surgery. So, I wouldn't like to look back on a career full of exploitation, because as I said, lots of women, lots of men, they come for aesthetic surgery, not just penis enlargement surgery, and they come because they want to feel better about themselves. They want to get more self-confidence, and many have these procedures, and they do. And lots of guys have penis enlargements done, and they're perfectly fit, young, healthy men with no hang-ups particularly, except the size of their penis. And when they have the procedure done, generally they're very happy. Having said all that, let's be clear, and your doctors in the studio will appreciate this, that there are some people who come, Asian men, Caucasian men, and black men, who come for penis enlargement, and we consider them not suitable, no matter what their penis size is, because they may have other issues that do require attention.
So you make an assessment in terms of all those other things. Just briefly, could you tell me what is the average cost, and what do you actually do?
Well, in terms of surgery, our urologists can lengthen and or thicken the size of a penis. They can lengthen it in the flaccid state and thicken it flaccid and erect. And most guys that come tend to want both. They want the penis lengthened and thickened at the same time. And that costs £7,500.
$7,500. That's quite a lot of dick you'd want for that amount of money.
Yeah, well, I mean, it doesn't. When you think about a typical penis, if you're increasing it by 2 inches in the flaccid length and 2.5 inches in girth, that trust me, that doesn't make a significant difference,
Can I just ask, does it increase the actual erect length, though?
No, that's what it doesn't. So it doesn't. Again, if we get a guy coming and he says, look, I want to increase the erect length of my penis, then it's a very short consultation, because, pardon the pun, he doesn't do that.
David, I appreciate your honesty. Manny, I want to get your opinion on this. If you were, in the throes of passion, Manny, and a guy's, what are you expecting? Do you think penis size matters?
No, definitely not. It's what you do with it that matters.
It's what you do with it that matters.
Yeah.
And what if, as David just said, someone could spend £7,500, they could get the girth and the length increased, but it wouldn't actually affect the size of their erect penis anyway?
It's a waste of money. What's the point?
Do you think it's a waste of money?
Yeah.
So, okay, I mean, I think lots of men will be thinking, okay, this is really good. But have you ever been in a situation where you've been with someone and you've thought, okay, that penis, you're surprised at the length of it, either, on either side of the spectrum?
No, not really. I've never been with a man that's got a small dick, so...
But what would... We're all sniggering like school children here, but what I'm really asking is, what would count as small for you? Or in all seriousness, would it matter more who it was attached to and what they'd done beforehand and what they'd done to build up to that point,
It don't matter to me, really. It just depends what they do with it, and if it matters, as long as they're good in bed, it shouldn't really matter how big the dick is.
Just all the other stuff. Faris is shaking his head. Faris, go for it.
You hear it all the time. Women aren't being sexually pleasured in the bedroom and they end up breaking up with their partners. That's just them being honest. So it's like, to say like, it doesn't matter and it's how you use it, that's like the positive way to look at it, isn't it? But the realistic way, I feel like a lot of women do judge it, whether they say it or not. And I think sex is a huge part of keeping a relationship together, and if a woman isn't being pleasured in bed because her guy's dick isn't up to standard or, pleasures her body personally, then that's a problem.
But you're focusing again on the penis being the deliverer of pleasure. And actually, as I said, it's your mouth and your hands that do more of that. A woman's sexual sensitive organ is on the outside. So if you're going to be actually having sex with a vagina, which is the tube on the inside, yes, there is some sexually sensitive material, but it's not actually that sensitive or that comparative to the clitoris. So actually spend your time on the clitoris, on the vulva, so the area on the outside around the vagina. If obviously you're focused on actually you need to get your penis inside that vagina for it to count as sex, then I think you need to look at what sex means for you. Absolutely, if you want to have a child, yes, you need to deposit your sperm inside the vagina or around the vagina because they swim. That's what their sperm swim. But the idea is just to make sure that is the partner enjoying it, male or female? Are they having fun? Look at their face, look at their body language. Are they into it? Because if they're into it, they're going to have much more excitement and enjoyment of whatever your size penis is. And particularly if you've got a large penis, for example, trying to get it inside it can be very uncomfortable for a woman. It can be really problematic, actually. So, and there's this, you want to try and make sure that actually both are lubricated, both are excited, both are having a great time. So for me, telling someone that penis size doesn't matter, okay, I get it's difficult to hear. Absolutely, it's like being told, I don't know, something, but you want to make sure that you feel and you believe that, but actually you'll only believe that if you're with someone that you're regularly pleasuring and enjoying the time you're having with them, and they're really not bothered, or they might be bothered, but actually you can work past it.
Dr. Anand, it really strikes me that everything you're saying is suggesting that this conversation and the net result of the conversation about penis size is actually all about the mind and not really about the body. It's about having an education in terms of how to perform sexually.
I don't want to be corny about it, but your brain is your sexual organ. When men ejaculate, that's all that is a propulsion mechanism squeezing some juice out of a prostate. However, and your testicles. However, actually, the orgasm you feel is in your brain. So actually, you do need your brain engaged. Women need their brain engaged to orgasm.
I completely understand. Manny, can I ask you, have you ever been in a situation where, regardless of penis size, you've just said to someone, look, I want you to do it like this? Or have you ever had to sexually educate your partner?
Yeah, when I first got with my partner, because they're a bit younger than me, I did think, oh God, it's not that good. But I think if you teach them, and I suppose when you fall in love with someone, the sex becomes on a different level. Do you know what I mean?
I completely understand.
It's different. Like your feelings towards them are different, and everything's different when you're in love. I personally think.
I really appreciate that. Go on. Of course you can, David. Go for it.
Yeah, a couple of points there. I mean, it's great what we're hearing, but I mean, I've got to say, I see a lot of men whose penis is so small they can barely, if at all, penetrate their partner. So,
really?
Absolutely. I had a call today.
Is that a condition? It's called micropenis.
Under 7 centimetres officially micropenis.
Now, absolutely right. And with the best will in the world, all the counselling, all the talk, all the reassurance is going to do nothing for that man. And he needs help. And frankly, they really shouldn't be coming to clinics like us and having to pay, because that sort of procedure should be routinely available on the health service.
Is it available on the NHS?
So if you strictly have a micropenis...
Faris, I'll bring you in afterwards. Go for it.
So if you have an official micropenis, which is under 7 centimetres, then you can be referred to your urologist. Under the NHS, that is the only group, really, that's now treated. There used to be sort of psychological distress by patients with slightly larger penises, but that's not the case anymore. And it would have to be one of those special cases. They'll have to requisition funding for it to be taken. It is available, but I do understand what David's saying, because actually some men are so fixated on their penis size that if you do not help them with it, they will go to great lengths to damage their own penis to try and get a big penis. There's something called jelking. I mean, I don't know if you've ever seen those rollers that you use on cricket pitches, variation. But you see the rollers you see on cricket pitches? Well, you get one of those that basically wraps around the penis. So you squeeze your penis between two of these rollers to try and extend it. And I've seen people damage their penis so much that they can never get an erection again at 18 because they've been trying to stretch it so much with weights or whatever.
Don't do any jelking.
Oh, mate.
No
so
jelking.
in all seriousness, Dr. Anand, if someone has micropenis, what can be done on the NHS?
So again, it's a special request referral to the urologist. The urologist will have a look at it. They may be able to requisition funding for it and say, actually, look, can this be operated on? But again, remember, you're going to get visible length improvement. Now, that can be enough, actually, to improve the mental health of some men. I completely understand that. But it doesn't improve the erectile length. Now,
Is there any way is there any method that we currently have that will improve erectile length?
Not as far as I'm aware. David, I don't know what you think.
No, absolutely right. I mean, the surgery itself, our urologists say that in the penile lengthening surgery, a procedure called ligamentosis, it can increase the erect length by up to 1 centimetre. But frankly, we just say to patients it doesn't increase erect length at all, because 1 centimetre is not going to cut it for most men.
That's not really going to make a difference, is it?
That's not going to make a difference. And just jumping back to what the lady said about how a man uses his penis, of course, is very important. But earlier this year, we surveyed 180 women, because we thought, well, we're going to ask women, what do women want? Because when most men come in for penis enlargement, they say, I just want a penis that's normal. And when we ask them, well, what do you think is normal? They're not really sure. But we surveyed 180 women, and 90% of those surveyed said they wanted a larger penis than the one that they were currently living with. And not one woman wanted a penis that was smaller.
Faris,
that's on our website.
That's really fascinating, David. Faris, you pulled a face then. Do you think a lot of that has to do with porn? Is it to do with the pornification of society and the idea that, you know, what Dr. Hannan was saying earlier about seeing big dicks in pornography? Like, do you think women are more prescriptive about the penis size they see as required because there's more big dicks on display?
I think porn plays a bigger deal to men than women, and I think for women, if they want a bigger dick, it's simply because they're just not being pleasured enough. I think that's just the bottom line. Like David just said about the survey they did, it's clear that women, I think they just feel a bit bad, you know, to tell their partner they don't want to damage their partner's ego or anything, so they secretly go off and tell other women or confess on online anonymous blogs that, you know, they're not being sexually pleasured enough, and then that's why I said earlier on they end up cheating and breaking up with their partner, but they won't ever tell them that that's the reason. But it all starts from something as, you know, sex. And I know you did say earlier it's the way you use your tools, and, you know, most of it is on the clitoris, and you can do that with your mouth and your hands, but also, you know, David just said there's people out there with micro penises. You know, that's just simply not penetrating a vagina. And no matter what they do, you can't extend the length of your erect penis. So these guys...
The issues, and forgive me, you have to learn a way to cope.
Yeah, you have to.
And forgive me, so I don't mean that in a harsh way.
No, this is really important.
My hair fell out when I was 14 years old. So, like, you know, I can't get it back, so much of it's fallen out. I'd really like to have my hair back.
Yeah.
However, I can't do anything about that. And so it's not great, you know, as a 14-year-old having your hair fall out. However, you kind of have to learn to cope. And I recognise that for people it can become a suicidal issue. I'm really not denying the fact it can be so impactful they won't have relationships. I mean, we talked about that already. What I'm saying is, how can we try and help you to get to functionally use what you have? And actually, if it, for example, is, you know, 2 inches long and that's all you can use, what can you do with that? What can you use extension devices? Can you use your hands? What else can you do? Can you use toys on your partner? Will you accept that as part of your sexual routine? And some people, I understand, won't and will continue to be distressed by it. I mean, we can't solve the fact that some people just have a smaller penis.
I think this is crucial, Dr. Hannan. It raises a really important point that if there are people listening that do have micro penis, there is help available. And I think, and correct me if I'm wrong, but maybe a first step in getting that help is just speaking to someone and speaking to the right people.
Absolutely. Come and see your GP. And I appreciate not every GP in the land will be necessarily understand that first of all, but it would be really helpful if, for example, they speak to them and get referred to a psychosexual service. You know, often they're normal sized penises or in the normal range, which I appreciate is quite broad, but actually, as you said, you know, a vagina, if that's what you're going for, is 8 to 10 centimetres long. I mean, obviously, if you're going for, you know, there's a body mismatch. If they're different sizes, if they're big buttocks and whatever, you know, that does mean that the penis may have to be a different size to accommodate that. But that's just what life is.
Thank you, Dr. Hannan. Faris, go on, you go for it.
I think the best reference for this that I can think of is height. You know, some guys, they feel a bit short, and some women will say, you know, I don't want a guy who's short. There are ways you can max your looks in life. I truly believe that if you are able to max your looks within your reach, you should do it. Some guys get insoles that makes them look a bit taller, you know, wear, like loafers and Timberlands, whatever. Same reference to this, right? If you are able to, if you can afford it, if it's easy for you to go out and get your flaccid dick to look a bit better, if you've got $7,000 to spare, go ahead. But you don't need to do that. I think this is more of a, find someone who accepts you for your body and just learn to accept the penis you've been given and embrace what you've got rather than focus on what you don't got.
Amen.
Absolutely. I want you all to listen to something. This is from a documentary called My Penis and Everyone Else's.
Jared has a shock in store for me about the size of his penis.
I'm 7 inches long and about 6 inches in erect circumference.
So why are you having surgery?
Because I know that when I walk out of that room tomorrow, I'm going to look down and I'm not gonna have one shred in my heart. All the girlfriends in the past, oh, Haas, you got a banana dick, your dick is skinny. And hearing those girls talk in the bathroom, all that's gonna end when I wake up.
But why does it matter what they think?
What it boils down to is if you're thick and you're filling that hole, it's gonna give your girlfriend pleasure. And if you're like me and you you've been cheated on, and you've been whatever my hang-ups are, and you want to feel 100% secure that you are smashing your girlfriend and that she is absolutely overjoyed with the fact that you have a thick cock and she's not going to go somewhere else, that's why I'm getting it.
And what would stop you from having that surgery tomorrow?
The only thing you could say to me right now to stop me from having it is, Jared, I'm psychic, and there's going to be a problem tomorrow. You're going to get a blood clot, and you're going to die.
That was from BBC Three's My Penis and Everyone Else's. Dr. Anand, I just want to ask you, it really struck me there that the man who was speaking, he referenced things like being cheated upon, and it sounded to me like his problems were not physical. They were to do with his history and they were emotional. Do you think that's a fair assessment?
I think it's much easier sometimes to break a relationship because you say the sex isn't good, or actually maybe the sex isn't good, but actually no one wants to hurt anyone else's feelings. It's amazing how we can talk about lots of different things, but we can't actually talk about the sex we're having with our partner. We don't actually go, do you know what? I don't quite like it when you kiss like that. It's a bit like kissing a washing machine. Would you mind just winding your tongue in a bit and just not being so wet? But actually, some people don't know how to kiss their partner, and maybe that worked really well with a previous partner. The issue is we've got to learn the landscape of someone's body, and that's a brilliant period of time, and how much fun to learn what gets both of us going. But actually, we're so focused on, there's just like two stops. You touch the breast and you touch the vagina, or you touch the bottom or the penis, or whatever you're touching. There's just those pure stops. There's not other erotic zones. There's no pleasure to be gained in anything that doesn't involve an orgasm, which is ridiculous.
It's ridiculous. I understand. David, I need to ask you, when you do your assessments, do you ask about people's relationship histories? Do you ask about things like rejection? Do you ask and do an assessment in terms of where they are psychologically?
Yes, we certainly do. It's a very important part. And there is no doubt that guys come in and they've been told by their previous sexual partners that their penis is small. And, we have to take that kind of thing very seriously. And there are some patients who we do refer back to their GP. They have other issues going on. Sometimes they're simply not suitable for surgery. They have other medical conditions that... penis enlargement is the last thing they should be thinking of. But at the same time, I think we have to say, that we see a lot of guys who are coming in, and penis enlargement is a lifestyle choice, as is cosmetic surgery generally. They may have a normal penis, but they just want a bigger one. And in this day and age, if they can go out, they've got the money, and they want it, they're going to get it.
It's a matter of personal choice.
It's a matter of personal choice. We get, as I say, we get patients who are, they're very down about their penis size. They're very upset. It's affecting their quality of life. But at the other end of the spectrum, we get guys coming in and they're saying, well, look, I know my penis is normal, but I just want a bigger one. I just going to make me feel better.
David, do you think, and then I want to ask Faris as well, do you think we'll ever get to the point where, a decade ago or 15 years ago, a boob job was seen as something that was quite specific and quite particular, and only certain people would get it? Now it's fairly standard. A lot of people get that kind of surgery. Do you think we could end up in a place where a penis extension is the go-to? It becomes completely normal?
Well, I think possibly yes. Unfortunately, I'm a bit long in the tooth, and I do remember the days when, I started off working in a clinic in Sheffield that had a bus stop outside of the clinic. This was in the 1980s. And we carried out lots of breast enlargements at that time. But half the patients that booked an appointment wouldn't turn up. And we thought this was really odd. But when we contacted the patients, they said, yeah, sure, I came to your clinic, but you didn't tell me there was a bus stop outside, and there was no way I was going to walk up your path to the door, people looking at me on the bus. And that was breast enlargement. And that was 20 years ago, 25 years ago.
So that stigma has just dissipated.
It's just disappeared. You wouldn't even think about that now. One girl tells another girl, tells another girl, tells another girl she's had a breast enlargement. That's not happening with penis enlargement at the moment. Most guys don't want to tell anybody that they've had this procedure, but it will change. And I think 20 years from now, I think... the way things are going, I just don't think it will be a big deal. But it is at the moment.
Faris, does that worry you? And I know, David, from your perspective, I understand you've said it's about personal choice, but it's also, you will benefit from that, won't you? And your industry will benefit from that. Faris, do you think that's worrying?
What, that guys will...
Yeah, that it could become a standard thing.
I don't think that's a worrying thing. I think that's good, if anything. I mean, I know this girl who went to my school and she got a boob job, and I think she was like one of the first girls I knew who got a boob job, and everyone was like, "Oh, do you know Thingy got a boob job? Thingy got a boob job," and it was like, "Oh my god!" And then after that, she honestly was way more confident with her sex appeal. And it's like people say, you know, love yourself, embrace yourself. To the most you can, obviously do that, but these kind of cosmetic surgeries really do address people's insecurities. So if you can do it, like, it's so common, like you said, for women to go and get it done now.
You just say go for it. I just want to bring, because 728 has texted in saying, of course a man's dick size matters. I've met 2 guys with small dicks. If his mouth isn't doing the job, you'll not stick with him long either anyway. And it's not about the motion when there's no substance, i.e. measurement to do the job. Personally, if he was small, there's really no point keeping him. I think that's really harsh. Manny, what do you think of that?
That is really horrible, because people shouldn't just go on like how big it is. It's not all about how big it is it?
You just think that's wrong. And Dr. Anand, go on. What do you think of that?
I think we have to be realistic. Not everyone will find you attractive. Not everyone will love the way you kiss. Not everyone will like your penis. Not everyone will like your breasts. You know, that is your life, and you choose the person that actually, hopefully, will put up with your visual failings as well as your emotional failings. And if they look after you and care for you, and you do vice versa, brilliant. There are some people, however, who want to change the way they look. From my point of view, ideally, in a world that's really like lovey-dovey and touchy-feely, we would all be like loving our bodies and embracing everyone else just for who they are. That's not true. That's not the world we live in. So from my point of view, it's kind of going, let me try and sort out those people that are so psychologically hurt by the physical condition they have that I need to hopefully help them and work with them to get them out of that condition so that they can actually embrace their bodies if possible, or at least not hate themselves. Now, I appreciate if there's something you can fix and it doesn't do you any harm, then I can understand that. But actually, surgery has risks. If the risk is potential, and I know it's very low risk, but you've got to go through an anaesthetic, you've got to have bits of your penis cut. And I know it's the ligaments, and therefore it's less likely to cause you harm. But again, there are risks. So the issue is you're putting your psychological concerns about the perception of your penis and about what problems it might create in a relationship. And that lady was quite right. It might be that actually small penis is something that doesn't work for you. And what you need is a wide, long penis. And if that gives you sexual pleasure, then you'll be looking for that man. However...
Sorry, beg your pardon.
No. David, go for it. Come on.
No. I was just going to say, do you know what procedures are the most rapidly growing procedures in aesthetic surgery, or have been in the last 5 years?
I don't know.
Well, I'm going to tell you. Labia reduction surgery, labial puff treatment, and vaginal tightening. Now, what does that say?
That they've been watching far too much pornography.
Well, isn't there an argument that that's also to do with porn, isn't it? Because where do you see those vaginas with kind of micro labia?
That's all been done because since the 70s they've had pornography, and they've actually gone, well, how do you visually show the vagina more? Well, okay, if you remove the hair, you can actually see a penis moving in and out of it much more. How do you make a penis look bigger? You shave all the hair at the base. So there's all these tricks to actually make porn look more exciting. Rimming wasn't really that much of a massive thing. However, they have to visually show that. Okay, because it's a visual thing that you can show. So then that becomes normal. They did a whole series of studies of young people looking at breasts, and they gave them a series of breasts, some of which were fake, some of which were normal. So not normal, so forgive me. Some of which were fake and some which hadn't had an operation on them. It's still pejorative, and I forget. So the idea was that lots of the young boys thought that actually the breasts that have operations on were the normal.
Were the standard quote unquote
normal breasts. And that is slightly problematic.
I understand. We are going to have to leave it there. Dr. Anand and Faris, thank you so much for joining us, and David Mills and Manny as well. Thank you so much if you text in.